Do you have someone in your life who can be incredibly damaging and destructive to you? Hi, it's Gabrielle, and in this video, we're going to talk about the causes of narcissistic personality disorder, or NPD. Where does this disorder come from, and how does it develop? Are people with narcissistic personality disorder just born that way, or did something happen to them early in life that can account for their cold, destructive behavior? For over 12 years, I've been a licensed professional counselor and relationship expert in private practice in Boulder, Colorado, and my practice is grounded in the science of what makes relationships work. Today, we're going to go back to the roots of narcissism to understand how this condition develops and what people with NPD need to come to terms with in order to heal and engage in a warm, secure relationship. So let's dive in. If you like the relationship tips and couples advice that you're learning here, please remember to subscribe to my YouTube channel right now. Just click on the subscribe button right here. And if you're enjoying this video, please give it a like and share it. And please go to thepowercoupleformula.com for lots more useful information about how to build an amazing relationship, and powercoupleseducation.com to stay connected. So let's dive in. As a couples therapist for over a decade, I've seen the damaging effects that narcissistic personality disorder can have on intimate relationships. I talked about that fundamental distortion that is common to all personality disorders, that distortion in the sense of who the person is and how they see other people. Now, in the case of NPD, that sense of distortion is in place to cover up deep feelings of humiliation, shame, and emotional pain that the person just doesn't want to feel. In fact, if they really let themselves feel those feelings, it would probably feel like they were just falling apart. But where does this pain come from to begin with? There's so much information out there about narcissistic personality disorder, but one of the things that I find isn't talked about enough is where this disorder comes from and how it gets started in the first place. And that's exactly what we're going to talk about today. So let's dive in with a bit of human development to understand what's normal and then what gets off track with NPD. At birth, you are poorly equipped to handle all of the stimulation that you're receiving from your environment. You're just a little baby. And when you're a baby, you're dominated by this instinctual part of your brain that is designed to keep you out of danger and keep you safe. But the thing is that you're in danger of going into shock when you're that little because of all the excitement and the unpredictability in the world around you. So a parent needs to regulate your energy and your feelings, because as a child, you have a very immature emotional system. You need a parent to make sure that you're not getting overwhelmed by your surroundings. You need someone to soothe you and play with you in a way that's developmentally appropriate for your abilities and your tolerance at any age. This is what allows your brain to develop more and more complex abilities to handle your emotions and deal with the world. Because you can't self-soothe at that age. It has to be done by someone else. I mean, you can't just tell your 1-year-old to go meditate when they're crying or chill out. So we need a parent to perform this regulatory function for us right from the beginning. Now, as you get a bit older, you start to separate from your parents and become your own person. Like between 9 or 15 months, you start to crawl, walk, and explore the world, and you gradually move away from your parents and you start to develop your own unique abilities. During this period of development, they say that a child has what they call a love affair with the world. The world is your oyster because everything is just so new and you've never seen it before. And if you've ever seen little kids at that age, they're just so full of wonder and enthusiasm for every moment and what they're going to find next. So you're infatuated at that age with everything you can discover from your environment. But this period of development requires that your parent continue to act as a kind of mediator between you and the world. Someone has to be watching over you and making sure that what you're encountering as you begin to explore the world isn't too much for you. So you need a parent's support to plow ahead, and you need to know that they're going to be there for you so you can return to them if you run into problems or get tired or overwhelmed. Now, during this period of development, things can go wrong. And if they go wrong between this time of 9 to 15 months, that is likely going to lead to a narcissistic personality disorder later in life. So what do we mean when we say things go wrong? So we're saying that the child has a love affair with the world at that age. The child is deeply absorbed in their own functioning, their body, in walking, in peeing and pooping and talking, as well as all the objects that they're finding around them and their goals, like walking across the room to get their favorite toy. They're unfazed when they fall down or get bumps and bruises. They just pick themselves up, back up, and go right on with what they want to do. But the truth of the matter is that if there isn't a parent there who is making sure that that infant doesn't get overwhelmed or isn't in danger or doesn't encounter too many obstacles, that child wouldn't get further than a few inches before they would completely fall apart, because the environment is far too stimulating for a child to navigate by themselves. With narcissistic personality disorder, there's a problem with that regulating function that the parent is supposed to be providing. The infant needs the parent's support in order to actually feel like they're having success at these things. This is a period of healthy narcissism. Then the child needs to feel good about themselves, their capacities. They need to have successes as they master walking and talking and going after things that they want in the environment. The child needs to feel that they're great and that the world is theirs for the taking. That's normal and healthy. That's why we call it healthy narcissism, and it's appropriate for that early developmental period. Of course, the truth is that during that time, the child is actually very vulnerable and needs to, in a sense, borrow the sense of strength and capacity from the parent in order to deal with the world. So even though the child feels like, this is me, I'm doing it, I can walk, I can move, of course, none of that would be possible if they weren't borrowing that sense of power from their parent. And that's natural. They need to feel like they've got it together and they can handle things, even when they don't have the skills or the ability to manage their emotions or even use the toilet for that matter. So their parents need to give them lots of support, make them feel great about themselves as they take their first steps or they say their first words or explore their environment. It's only with this kind of encouragement and someone reflecting back to them how great they are that an infant can develop the courage and the self-esteem to tackle challenges on their own. This kind of reflection provided by the parent is called mirroring, because the parent is mirroring back to the child their capacity and their value. And that mirroring needs to have energy from the parent. The parent needs to be truly invested in the child's pursuits and the child's attempts. And you see that in healthy mother-infant dyads, when you see a mother who's, cheering their child on for taking their first steps and celebrating along with them. But good mirroring from a parent doesn't only involve cheering your child on and celebrating with them when they achieve something. It's also that when your child is struggling or they can't do something they were trying to do, like maybe they were trying to walk up the stairs and they just couldn't make it. They just weren't coordinated enough yet. In this case, the child is probably disappointed and might even really break down and start crying. And the parent needs to be there in order to hold them, to reassure them that it's okay and that they're always loved. Now here's the place where things can get off track and lead to narcissistic personality disorder. What happens if you have a parent who never cheers on their child, who never celebrates their successes, who doesn't even watch what they're doing, and is only concerned about the child messing up? Or what happens if you have a parent who thinks their child is God's gift to humanity? It's like rather than just celebrating and cheering them on in a way that's truly supportive, they make the child feel like nobody could possibly live up to how great they are. So the first example there is a real absence of mirroring, And the second one, you could almost say, is kind of like over-the-top mirroring. And both of those can be problems that lead to NPD. In both cases, the child doesn't get the appropriate mirroring and reflection they need in order to develop a healthy, balanced sense of self. And that's again what we mean by the term personality disorder, in the sense that the experience of being a person is in some way disordered or distorted, because they didn't get the accurate reflection they needed at that critical time when they were forming a sense of self. So let's look at that first problem, the lack of mirroring. What happens in that situation is that because a child just realistically isn't capable of managing the world and modulating the intensity of activity and stimulation that's going on all around them all the time, not to mention their own emotions and energy, the child becomes totally overwhelmed and has the experience that they simply can't do it. There's no one there to cheer them on when they have a success, and there's no one there to comfort them when they get hurt. They are left completely and utterly alone. And those children learn at that age that they have to navigate the world alone. What really happens is that that natural sense of what we call healthy narcissism never really goes away. It sort of becomes a permanent condition because there was nobody there to really help the child deal with reality. And so they have to maintain this sense of themselves as this godlike presence who can do anything all by themselves. They've got this, they don't need any help, and it's completely up to them to run the world. I hope this video gave you some insight into how narcissistic personality disorder develops. And none of this is an excuse for being abused or neglected if you're in a relationship with someone who has narcissistic personality disorder or who you suspect may have it. But hopefully this understanding about the early development that leads to NPD can give you some understanding and relief. Now let's hear from you. When you think of the person or people or maybe yourself who you think might have NPD, could this childhood description account for some of the problematic behaviors that you see with this person today? Leave me your comments below. I look forward to reading them and seeing you in the next video.